information. Arguing for the end of adult marijuana prohibition is easy because we have facts, science, reason, compassion, evidence, truth, and logic on our side. It is even easier when researchers catalog it all for us. Learn how to gather the facts on marijuana use, arrests, seizures, rehabs, drug tests, and more in this edition of Drug War Data Mining. Welcome back, everyone. 22 and a half after the hour, and following up on our Behind the Headlines, we're taking a look today at Quest Diagnostics. Quest Diagnostics is the world's leading provider of diagnostic information services for patients and doctors, all sorts of testing that includes drug testing. Some quick facts about Quest Diagnostics. In 2013, they generated revenues of approximately $7.1 billion. So there's some money in this drug testing stuff. And according to their fact sheet, Quest Diagnostics touches the lives of 30% of American adults each year. 3 out of 10 people, almost a third of Americans, will deal with Quest Diagnostics at some point in a year. Many for workplace drug tests, some for hospital visits where their diagnostic equipment and such is used. And Quest Diagnostics is ranked 341st on Fortune magazine's Fortune 500 list for 2013. So we are talking about a Fortune 500 company. Now, Quest Diagnostics is famous for putting together what is known the Drug Testing Index. And let me post this in our chat room so you can follow along if you like. Every year they will release this Drug Testing Index, and it usually comes around September. And in their most recent drug testing index, they state that the workforce drug test positivity rate increases for the first time in 10 years, driven by marijuana and amphetamines. Dun, dun, dun. Okay. And some of the information on this, here's some of the facts. The positivity rate for the 7.6 million urine drug tests they took, 7.6 million piss tests for the combined U.S. workforce, and that means regular jobs and safety-sensitive jobs, all combined, every job. 7.6 million P-tests in the workforce, and 3.7% of them came up positive. That's compared to 3.5% in 2012. So it did go up. 3.7% of the people who took a drug test in 2013 failed it. That's an increase, relative increase, between the 2 years of 5.7% from 2012 to 2013. And the first time that positive drug tests have gone up since 2003. And Quest has been analyzing these since 1988. And the guy in charge of this, their director of science and technology, and I shit you not, the guy's name is Dr. Barry Sample. So Dr. Sample says that this increase indicates that employers should be aware of the potential for drug use by their workers and the risk that represents for the health and safety of their employees and the public. Right, because someone who smokes a joint on the weekend might be dangerous somehow. Speaking of marijuana specifically, marijuana positivity in the combined U.S. workforce increased to 1.7% in 2013 compared to 1.6% in 2012. So of those 3.7% that are turning out positive, 1.7% are the marijuana ones. So what is that, about a third, something like that, of all positive drug tests coming up for marijuana? But in the general U.S. workforce, this would be non-safety sensitive. In the general workforce, it increased to 2.1% compared to 2% for the prior year. Now, I think it's also illustrative to think about the various states that are attempting to do drug testing for welfare. In particular, Florida, when it did its drug testing for welfare, in the 3 months that it did it, it found a positivity rate, an overall positivity rate of about 2%. Compare to that to the 3.7% overall positivity rate for the U.S. workforce in general, and you find that people on welfare are getting popped on the drug test less than people that have jobs. Now, looking at Colorado and Washington, some would theorize that Colorado and Washington may be leading to this increase, and that does seem to be the case. Positivity rates increased 20% and 23% respectively for Colorado and Washington. So over 20% increase, relative increase rates for Colorado and Washington after legalization. And if you go to this page and scroll down quite a bit, it'll talk about oxycodones and other, drugs, but you'll eventually get to the annual positivity rates, which you can see in 1988, drug positives were 13.6%, and they declined every year from that point on, or stayed the same. For example, 2003 and 2004, it stayed at 4.5%. There has been a constant decline in drug test positives all the way until 2013. They'd been stalled at 3.5% since 2010 and rose to 3.7% in 2013. The data will also be broken down for you by whether it's general workforce, combined workforce, and so forth. So in the general U.S. workforce, again, drops from 4.2%, 4.1%, and now up to 4.3%. The leading reason for positive drug tests still remains for cause. That is, somebody had an accident, there's some suspicion of drug use, 9.3% positives in those cases. In the case of pre-employment drug testing, people just trying to get a job, only 1.8% of the drug tests turn up positive, and a far lower rate if it's just considering marijuana. There's plenty of data to be found here for different types of urine testing, hair testing, and so forth, oral fluids, saliva, and all of that. You can find it at